Sanibonani, goeiemorgen, and welcome to your biggest and brightest breakfast show, Good Morning Africa. Ongoing health. I have our resident doctor here, Dr. Mohamed. Good to see you.
Thanks for having me, Tara. Good to see you too.
Today we'll be talking about a male infertility. So tell me, doctor, if a person has a difficulty getting an erection, does that mean they're infertile?
No, not necessarily. The two are separate. Infertility is separate from erectile dysfunction. Erectile dysfunction just means that one has an inability to either attain or maintain an erection sufficient for sexual intercourse, whereas infertility means that the inability to achieve a pregnancy after a year's regular intercourse with a fertile woman. Okay. So the two are mutual, they're separate. And if a person is impotent, it doesn't mean he's infertile. Whereas if he's infertile, it doesn't mean that he's impotent.
Is ICSI more successful than reversing a vasectomy?
Well, like I mentioned, if the vasectomy is a recent occurrence, it's quite easily reversible. But ICSI is used, it's used to actually deal with all male infertility problems. Usually with ICSI, you can cure mostly, not cure, but you can treat most male infertility problems quite adequately and achieve fertilization.
And how do things like hot showers, tight underpants, frequent masturbation, how does that affect infertility?
Well, look, masturbation is just like achieving an orgasm during normal intercourse, so it doesn't cause infertility. Hot pants and all those things, there's a lot of anecdotal. There's no evidence that it affects fertility, but what heat does affect the normal sperm production. It affects spermatogenesis. That is why in summer, normal scrotal skin becomes lax and the testes move away from the body. So heat does have a detrimental effect on, heat does have a detrimental effect on sperm production. Riding a cycle, things like that, hot showers, don't really have a great or irreversible effect. We know that if you take a hot shower or a hot bath very regularly, it may sometimes affect sperm production very temporarily, but not a permanent thing, no.
And if a couple is trying to conceive, how often should they be having intercourse?
Generally every 48 hours, because the sperm is viable for about 48 hours. So generally every 48 hours would be adequate. During the fertile period extends between, say, day 10 to day 16. So during that period, every 48 hours would be adequate. But generally we advise our patients to have intercourse every 2 to 3 days, and not take into account the fertile period only, because that period, when you're working around the fertile period, it produces stress, and that in itself may not be a good idea or a good thing.
What are some of the things you can do to improve the quality of your semen? Can diet affect that, or exercise, or taking vitamins?
Yeah, generally to lead a healthy lifestyle. In other words, plenty of fruit and vegetables. You can take antioxidants like Stamina Grow or something like that. You can take vitamin E, take zinc, which stabilizes the cell membrane. So those are some of the vitamins that one can take. But generally it's a good idea to, one, avoid smoking, avoid multiple sexual partners because of exposure to infection. During occupational, people who have different occupations like truck drivers, chefs who are regularly exposed to heat, to wear protective clothing. If you're in the agricultural field and you're working with pesticides or any lead-containing products, again, to wear protective clothing to protect. It's better to protect your fertility rather than improve it once the damage has occurred.
Some men have complained that after ejaculation, their first urination is painful. Is that normal? What causes that?
Yeah, and that should be normal. You see, what happens is that a normal ejaculate, right, contains secretion from, the prostate, from the seminal vesicles, from all these things. So once the penile urethra is very smooth, so when ejaculation occurs, you might get a little bit of burning post-ejaculation, when when one is passing urine, that's very transient and it's very temporary and it is normal. The problem arises if that burning sensation or the difficulty or the painful urination lasts for more than 1 day or more than an hour or two. Then you need to actually look at it. But immediately post-ejaculation, that would be normal.
Some couples complain that after intercourse the sperm flows back. Is that also normal? Does that affect conception?
You see, the ejaculate normally contains seminal fluid, that's semen, and with the sperm cells in the semen, right? It's not the sperm that comes out. It's just seminal fluid that comes out because they release the sperm to move forwards into the cervix and into the uterus. So the sperm actually leave the ejaculate and travel upwards. So that's normal.
STDs affect infertility?
Well, in the female, STDs predispose you to fallopian tubal blockage, which is about 70% of the time the cause of infertility in this country, in the female. But in the male, STDs do have an effect, especially if they sort of pass on to the testes. And if one develops an orchitis, that's an inflammation or an infection of the testes, that could definitely affect fertility because it would affect sperm production. Then, of course, the infection could spread to the prostate and result in a chronic prostatitis, which could again affect sperm quality. And then, there's a transport tube that transports the sperm. It's called a vas deferens, and if you have a chlamydial infection and a long-standing untreated chlamydial infection, it could block up that tube and it could again produce transport problems or even obstruction to the passage of sperm. So it would affect, sexually transmitted diseases would affect one's fertility.
Wow. Thank you so much, Doctor. Unfortunately, we have run out of time, but we will continue with male infertility in another session, so look out for that. There'll be a part 2 to this session. Thank you, Doctor. And
you're welcome.
If anybody needs to get hold of you or they have any more questions about male fertility, how can they do that?
Or they could email us on info@sentinfertility.com.
Thank you, Dr. Mohamed.
You're welcome.
As I said earlier, there is a part 2 to male infertility, so make sure you look out for that. Otherwise, if you have any questions for us, any comments, you can reach us at gma@planetimage.co.za. Thank you for joining me on Going Health. Enjoy the rest of your day, and back to you in studio.